Hello guys, it's me again, Mohammed Lansari. I am really sorry for this long break. I know I should keep an update. I've got this complaint from my international assistant. She's saying now we have placed an international number for help. I'll place it in the bio. And she's telling that why Mohammed is not doing any update anymore on YouTube. I know that I've announced that we are moving to an Instagram, but mainly this VT methodology or VT treatment thing went wild in the Arab world. So most of them, they need the care or attention or explanation, and mainly the mother language, mother tongue is in Arabic, and I think we have already stated everything in English, and we have all the information in this channel in English as well as in Arabic, and even on Instagram, if I posted something, you can translate it, and usually I also place translation. But yeah, that doesn't mean that I couldn't make a video based on most who demanded or requested. So for those who are new to this channel, my name is Mohammed Lansari. I'm an academic in Kuwait University Faculty of Medicine, a teaching assistant. 4 years ago, I had a hypothesis in treating vitiligo, and I also created this channel. So in this channel, I was just giving advices. I was just making a community of awareness on vitiligo, because what we are seeing as medical scientists, that many people are doing great work, good research, and dermatologists sometimes are aware and sometimes are unaware of these findings, or sometimes they don't believe in them yet. And I, based on this publication, try to make an awareness to medical doctor as part of my job as an academic teacher in Kuwait University Faculty of Medicine, and an awareness for us vitiligo patients. So I am a vitiligo patient myself. And I started this channel just to give an idea of, let's do it together. Let's make a revolution in treating vitiligo. Let's make it happen. And this method apparently worked with me. It doesn't mean necessarily it will work with you, but the clinical trials that the medical doctors, they've been doing for the last 4 years, showed that it is a real effective medicine, and for some people it's even the best medicine. It gives best results compared to any other medicine. So regardless of the methodology or what's the theory behind it, we've made many videos regarding this. You can go back to check it. You can read the published patents. It has the new theory, the hypothesis, and the new methodology. And we have just used natural components. My idea back then was to use herbal medicine or traditional medicine, because natural, I like to use natural medicine, and because it is known, there are a lot of publication regarding them. It's been used before, and maybe individually, or they've been some of the components have been extracted. So I'm not with treating vitiligo in individual medicines, like use corticosteroids or use tacrolimus alone, use antioxidant-based treatments. No, vitiligo is a multigenic multifactorial disorder, and I've been doing these videos just as an awareness of what's going on, and how based on the scientific findings, what we have found, others have found, and how we should treat it together. And once in a conference in the vitiligo symposium that happened in Kuwait, where consultant dermatologists, scientists that are interested in vitiligo and what's related to vitiligo, all came together. I raised this, I got the mic, and I was telling them that it is a multigenic multifactorial disorder. The way we should treat it is from the beginning. In the diagnostic medicine, we should check each and every individual, and we should treat each and every individual based on their parameters, their abnormalities. So the VT research group, or what the dermatologists are doing that are working in this project, they are doing a blood test and they're checking the internal parameter. We believe that these parameters, they have an influence to the condition and in the treatment. At the beginning, of course, when we got this natural herbs mixture, we just treat with the natural herb mixture and with water, okay, in combination with corticosteroids and protopic as an immunomodulator, tacrolimus, because the dermatologists were frightened that you're using different components, plant components that has a photosynthesizer, and you've tested them in the lab that they have both excitation emission and UVA and UVB at the same time. Although I added some buffering compounds, I've added immunomodulatory compounds. In the second phase, added some compounds that have been tested for peroxynitrite scavenger. I think this is the important antioxidant, not a general acetylcalase or any general antioxidants. And we need a potent antioxidant, and we need an antioxidant that keeps the tyrosine preserving, because this is the most important component that's needed in the melanogenesis. So with all these and other components together, as every experiment starts as a clinical trial or case of phase 0, they always skeptical to have test that is safe to use. So we use a combination of corticosteroid and natural medicine at the first beginning phase. So I had good results, but this is not clear whether it's from VT treatment or... So the second phase was to test it only with VT treatment. And to be honest, when I used corticosteroids, I had vitiligo spread, or when I stopped, it had a recurrence. And for me and for some other individuals, that the method alone without corticosteroids is working, and it's working without recurrence. So you might see that, yes, in the beginning it's only powder and water with corticosteroids. They removed the corticosteroid when they tested the safety and efficacy of the VT treatment. They used the VT treatment alone. It's giving good results. And the phase after it, they know that it's working alone, and then they tried it with different combination, like Dr. Hassan Fakani in Egypt. He's doing tissue grafting and VT treatment, and it is very successful for compared with the tissue grafting alone. Dr. Anwar Ramthan, Dr. Fahad Al-Mطوع, Dr. Najat in Kingdom Saudi Arabia also did different combination therapies. Dr. Huda Al-Safar, she and Dr. mainly it was the idea of Dr. Anwar Ramthan. They done fractional CO2 with a combination of VT treatment. It gave really good results. So now the clinicians, the physicians, or the dermatologists, what they are doing, they either treating with VT treatment alone, or they're treating it with combination with other methods, and it's all giving good results. So this is the history of VT treatment, and we have the Kuwait University have filed a patent for it, and this patent got published. And we have also you can check ResearchGate and patents, and you can read both publication. My students went to a conference presenting this patent, and they got an award, and I also presented the patent in the International Innovation Conference, where all patencies around the world, there have been more than 40 countries worldwide with more than 130 abstracts, and I got in this field a gold medal with compliment of the jury. Thank God, all what I have achieved is from God, and it's not from me or my knowledge. So thank you, Almighty God, for all this blessing and gifts for us and for helping us. And I know that it could be something annoying for, but if you sit with yourself and think, I have what we call in Arabic ibtila, like a condition, and there are other conditions in the world that are more severe, that's more unfortunate. And I'm a believer, and I think as long as I have a condition like this, I'll be rewarded in the afterlife, and it will be in the balance of my goodness that I was patient. But that doesn't mean that we don't find a treatment. I'm very happy that I made a lot of people's life much better, and I'm happy to dedicate myself for this field of research. So to me, when you go through to my story and to others, you would see our pictures. How was we before, and how was we today? How are we today, And it is a difference that, we are achieving, we are getting repigmentation, and we're heading there. So at the beginning, I had a recurrence. I got a good result, and then I had recurrence. So when I started to do VT alone without corticosteroids, I didn't have recurrence. So it's the same as last time when I stopped. I only do the treatment when I have vacation. And this last 3 months, it was good that the quarantine and the pandemics, so I am not working in the lab anymore. I got this problem when I work in the lab. I wear gloves, and it caused vitiligo to come back because of Koebner phenomena. But now I've been treating myself for these 3 months, and I've achieved a good repigmentation in acral area. So I need to work more on my finger. We're going back to the lab. This was still here, and now we're going back to the lab next week, which is good for my career at the same time. So I'm doing here a PhD in biomedical science, and some people are saying, why you're choosing the lens of the eye, why you're choosing and the second year tardigrades. They are the most important thing, in my opinion, to chase in heat shock proteins. Heat shock proteins are the proteins that preserve, that keeps. It's the paramedic of the cell. And I think the next revolutionary medicine for vitiligo will be something related to that. And we should understand, I should educate myself more about it. I've been doing a lot of recombinant DNA technology, which some people call it genetic engineering, trying to express these proteins and study these proteins, and maybe in the future how we use them as a therapeutic approach, or in therapeutic approach. If we protect the melanocytes and we protect the melanin, mainly melanin protein, from degradation and destruction of the melanocyte or the protein, then this is a therapy itself. That is, and this is a declaration to all, who are in this field. Try it. Let's make a race and see who would first find this and patent this and use it as a medicine. Yeah, so that's, I guess, everything so far. This is the updates on, Dr. Mohammed Al-Utaibi is the head of dermatology in Kuwait, and he's and also he is the head of the medical board for dermatology. He described this method, the VT treatment, and the VT treatment itself, as a revolutionary medicine. And he declared that it should be in the market by the end of 2020. We are in 2020, and we are heading there. So soon you would see it produced in mass production by a pharmaceutical company where you can all have it in your countries. And these pharmaceutical companies, they are making meetings with me through a commercialization company or patent related commercial company. It's called Oxentia, that Kuwait Invest signed a contract with to go forward with this. And it is good that when this patent is the rights that no one could use this composition or the way of treatment in these countries that are listed, the pharmaceutical will be more competitive to get the exclusivity for that, which means there is a good possibility that we might have it in a better price and in a good price. And this is not alone, I'm also thinking at the end of this year I will design other tablets. So the problem with vitiligo is you cannot use multivitamin. I don't know if you all know this fact. There are publications studied and gathered all this information. I thought that this multivitamin of vitiligo patient should have been produced long ago, not just now. So I'll just get this down here so you can see what we are having. So the problem that we are facing nowadays, we have to use a lot of drugs so we can treat the condition internally. Vitamin D, this is another concentration. This is the same actually, yes. This is 10,000 unit and this is 10 microgram. So it depends on if you are deficient or not. So if I'm deficient, I will use higher concentration. If I got it in a good range, I'll just use a low concentration for just maintaining the condition. Antioxidant ginkgo biloba. Okay, 1, 2. Beta carotene, tyrosine, and also we can use another amino acid that you will see in my tablet soon. This cannot be mixed with these. This is valerian. Copper, folic acid, iron, and some anti-inflammatory. You can use as aspirin as well, not just a Bastille. So these, what we should buy, I mean, mainly in my opinion, as to manage the condition internally and help repigmentation. Why we are buying it individually? Because we cannot use multivitamin, and because most of multivitamins, they don't have these composition, and because multivitamin, they do have high concentration of vitamin C, which also and other components that could stop or it's a tyrosinase inhibitor and it will not work with us, and the other things like valerian cannot be mixed with these components. So I mean, it is unfortunate that pharmaceuticals, they only in matters of multivitamins production, they don't care about a condition that is 1 to 2% worldwide. It's unfortunate. It's been a while that scientists discovered these things and have these publications. Some dermatologists use it, some are not. But if you come to in conferences or in gatherings, if you ask about this, if you give them an idea, they would just say, oh, why don't you invest in that? Yeah, we'll be happy to do it. They are not into investing in 1% or 2% of the population. Their machines are busy in producing proteins for, I don't know, bodybuilders or some multivitamins that can be used by everyone. So, okay, we don't need your help. We'll do it ourselves. I'm going to invest in this, and I'm going to produce these tablet series that we need. So instead of having all these. We have one tablet. Okay, thank you guys for watching. I'm sorry for the long videos. It's been a while, I know, and I hope that everyone is in a good health and wealth, and stay safe. Till next time. Goodbye.